Hey guys, it's Sarah. In this video, we're going to be going over a lab interpretation. So this is basically like a course for nurse practitioners and other healthcare professionals who want to know how to interpret labs. So before we get started, I just want to let you know that if you do want this to follow along in a PDF form, click on the link and it will take you so you can get your own copy. So one more thing before we get started is that this is really important to know. Do not use this solely for diagnostic purposes. This is not a complete list and many causes are not listed. You always have to look at the patient when you're interpreting labs. You always have to use your clinical assessment, your clinical judgment, use other labs, other diagnostic tests, and make a full picture. You can't just go based on a lab. And then in general, you always want to trend your lab. So, this could be this is the patient's normal. And it could be they have this because they have this disease. You always have to know what's normal and abnormal for them, and you always want to trend it. And another thing that you should know before we start is that normal results, they vary a lot. So different labs in different hospitals, they'll have different cutoffs, within the same range, but they'll have different cutoffs. So you could have a little bit slight different number somewhere else. And also note that these labs are for adults. This is not pediatric ranges. These are all adult, so someone above 18. And like we said before, always treat the patient, not the lab values. The lab value should only be used as an aid in the diagnosis. Then again, this is not medical advice and should not be used as such, and please ask your physician for anything else. So let's get started for the actual lab interpretation course. Okay, so first we're going to go into CBC. A CBC stands for a complete blood count. And so the first thing that we're going to be talking about is your white blood cell count, your WBC. Now, the normal range is 4.5 to 10.5, and what white blood cell counts are, what white blood cells are, is that they're part of the immune system that help to fight infection. So if they're elevated, that means that there's an infection present. It doesn't tell you what type of infection. It just tells you that your immune system, your shoulders are out fighting something in your body. So there's something happening there. So that's usually what it's used for, to see if there's infection going on. It could also be high for many other reasons, like some of them are listed here. Like I said, this is not all-inclusive. Some common reasons are dehydration. It could be from stress, exercise, trauma. Also certain medications could cause it to be elevated. Now, there are 5 different types of white blood cells. Your basophils, your eosinophils, your lymphocytes, your monocytes, and your neutrophils. Now, if you order a CBC with differential, so a complete blood count with differential, it will go into all those 5 and list how much of each one, etc. But since this is just a basic complete blood count, we're not going to go into each one. It could be too low for many reasons, like bone marrow failure. A lot of times cancer patients will have it too low. And the problem is that when it's too low, so like we said before, the white blood cells are part of the immune system that fight infection. So if it's too low, they're not going to have enough soldiers out there to fight the infection. They're immunosuppressed and they're at risk for infection, etc., because they don't have that much soldiers to fight it. Just note that if the white blood cell count is really high, like let's just say 30,000, you always want to rule out leukemia. So your next thing that you're going to be looking at your complete blood cell count at your CBC is your red blood cell count. So it's slightly different between males and females, but pretty much like 4 to 6. And what it does is that it measures the number of red blood cell count per cubic millimeter of the whole blood. Red blood cells have hemoglobin in them that carry oxygen to the tissues, etc. So that's why if it's too high, you'll see it in common stuff like chronic hypoxia, high altitude. A lot of time it's too low because you have anemias, renal failure, hemolysis. There's some hemolysis going on. Okay, next you're going to go on to hemoglobin. So hemoglobin is a slight difference between male and female also. For female, 12.1 to 15.1, and a male would be 13.8 to 17.2. Now, hemoglobin is the actual protein in the red blood cells that carry oxygen around the body. So it's pretty much going to be elevated for the same exact reason that the red blood cell count is elevated. Chronic hypoxia, dehydration, high altitude, congestive heart diseases, etc. And it will be lowered in the same exact reasons, anemia. How we usually use hemoglobin is usually to assess if someone's bleeding, internal bleeding, and anemia workup. So usually if someone's bleeding inside, their hemoglobin is going to drop. Now if it's below a certain number, let's just say usually the cutoff's around 7, then they'll get a blood transfusion if it's below 7. Otherwise, it'll just be trended. Hematocrit is a percentage, so it's the percent of blood volume composed of red blood cells. So it's pretty much almost going to be the same exact causes of high, same exact causes of low, and it's also used in anemia, etc. workup. Now we go on to mean corpuscle volume, MCV. So the normal is 80 to 100, and that's a measurement of the average volume, so the size of the red blood cells. So you're going to see it elevated in megaloblastic anemia, liver disease, vitamin or folate deficiency, which is usually people who are alcoholic. And you're going to see it lower in anemia, chronic disease, iron deficiency, because they're not taking enough in, sickle cell, etc. Okay, next we go on to the mean corpuscle hemoglobin. So that's MCH. We also have the mean corpuscle hemoglobin concentration. So that's MCHC. So the MCH reference range is 27 to 31, while the MCHC reference range is 32 to 36. Now the difference between these two is that the MCH is the measurement of the amount of hemoglobin per red blood cell, as opposed to the MCHC, which the last letter stands for concentration, is a measurement of hemoglobin concentration per volume of packed red blood cells. So the MCH is usually used in anemia workup, and so is the MCHC. If the MCHC usually gives like a rough guide as to the shade of the red blood cell count, like a low would be pale, etc. Next we go on to the RDW, which is the red cell distribution width, which is a percentage, it's 12 to 15. And that is a measurement of the variation in red blood cell size and shape. So it's helpful in differentiating iron deficiency from other microcytic anemias. Next we go on to platelet count. So platelet count normal is 150,000 to 400,000. Now what platelet count is the count of the number of platelets per cubic millimeter of whole blood. The problem with platelets is that if it's too low, then they could have a risk of bleeding out. So DIC, ITP, all these stuff of bleeding out. And if it's too high, then they have a risk for clots. So platelets count is kind of really important, and you want to watch out for that. So the last thing on a CBC would be your MPV. MPV stands for mean platelet volume, and that's 6 to 10. And what that is that it's a measurement of the mean platelet volume, as the name says. It's usually used in the workup of platelet disorders. So now, all that I just listed above was a CBC, was the complete blood cell count. Now, if you order a CBC with differential, then you're adding to what I just said above, to the CBC, you're adding a differential count. So it measures the percentage of each type of leukocytes present. So the neutrophils, the lymphocytes, the monocytes, eosinophils, etc. So now we're going to talk about BMP. BMP stands for Basic Metabolic Panel. So first we're going to start with glucose. Glucose, as you know, it's a sugar and it's a basic energy source for cells. A normal reference range is 70 to 100. As I said before, every lab is slightly different, but 70 to 100. If it's too high, so it's over 100, then it can indicate diabetes. And if it's too low, then it usually indicates an overproduction or an excess of insulin, because insulin lowers the blood sugar. Now, if it's too high, if someone's fasting, then if it's 100 to 125, then usually could indicate prediabetes. It can't really diagnose it. And if the person's fasting and it's above 125, then it could indicate diabetes. But you need further testing, but that could just clue you in. Obviously, if they just ate a donut and you're going to draw the blood sugar, it might just spike up. That's just because they just ate a donut. So you have to take everything into context, and like I said, you need further testing to diagnose diabetes. Next, we go on to the BUN. BUN is the blood urea nitrogen, and that normal range is 7 to 20. Now, what this test does is that it measures the amount of urea in the blood. Now, urea is a waste product of protein breakdown made in the liver and excreted by the kidney. So why it's important to know what it is, I would say that's the most important thing, to know what this test is because if you understand what it is, then you'll understand what causes it to be too high and what causes it to be too low. So causes that could cause the BUN to be elevated is renal causes. So like I just said, it was excreted. Urea is a waste product that is excreted by the kidneys. So if it's staying in you and it's elevated, then the kidneys are not doing this job to excrete it. So that's why you'll have renal causes for reasons why it's too high. Prerenal causes could be there's not enough volume. Renal causes could be something with the kidneys. And postrenal causes could be obstruction of why it can't be excreted. So those are just all different renal causes of why the BUN will be elevated. It could be lower in pregnancy if they're not eating enough protein, IV fluids, etc. It's usually used to assess kidney function, but it's best calculated with the creatinine. So now we talk about creatinine. Creatinine is slightly different between males and females. For male, it's 0.8 to 1.4, and for females, it would be 0.6 to 1.1. Now, what creatinine is that it's a byproduct of skeletal muscle breakdown. So when a skeletal muscle breaks down, it releases that, and it's removed from the body by the kidney. So like I said before, if it's removed from the body from the kidney, if it's not being removed, the question is it a renal cause? So causes of it's too high is renal failure, muscular dystrophy, and rhabdomyolysis. Causes of it being too low is decreased muscle mass, because like I said before, it's a byproduct of skeletal muscle breakdown. It's mostly used to assess kidney function because it's freely filtered, and it's inversely correlated to GFR. So if someone's creatinine is high, that means that their kidneys are not doing well, but if someone's GFR is high, that means that their kidneys are doing well. So it's the opposite. When you see GFR go down, you see creatinine go up, and vice versa. Now the BUN-creatinine ratio is basically just the rate of urea being removed depends on the needs of the body. So what it is that it's a ratio, like we said, between the BUN and creatinine. Now, the rate of creatinine removal from the body is at a constant rate and should not fluctuate, and the rate of urea depends on the body's needs. So that's why you could use a BUN and creatinine ratio to check for issues of dehydration, kidney injuries, etc. So causes of it being too high is kidney disease, GI bleeding, dehydration, and causes of it being too low would be a low protein intake, liver disease, kidney disease, etc. It's mostly used to determine the cause of acute renal failure. So next we go on to the GFR. GFR or eGFR. So GFR stands for glomerular filtration rate, and eGFR is the estimated glomerular filtration rate. So you want it above 60. So what it is that it's the amount of blood being filtered every minute by the glomeruli. Glomeruli are these tiny little filters in the kidney. So the amount of blood being filtered every minute by them is your GFR. And you want it above 60. It could be elevated in pregnancy, and it could be decreased in impaired renal function. Okay, so next we go on to calcium. So calcium, like we know, it's an essential element in the body, and it has many functions. Its normal is 8.5 to 10.2. It could be elevated when there's a hyperparathyroidism, bone metastases, etc. It could be, it's usually not decreased, but it could be decreased for hypoalbuminemia. Okay, so next we go on to sodium. Sodium is abbreviated as Na. Normal sodium range is 135 to 145. Sodium is an essential element. It is the primary extracellular cation. Now, it could be elevated from someone being very dehydrated, someone taking in a lot of salt, other conditions like diabetes insipidus. It could be lower than normal for if someone's drinking a lot of water. So it's someone taking in a lot of sodium because water follows salt, and other conditions like SIADH, etc. A lot of times it's used to evaluate hydration status, and it plays an essential role in volume distribution of water. Okay, so it's worth it to note here that even though I said that labs, they fluctuate depending on the lab in the hospital that you work at, is that certain labs are very precise. So when it comes to sodium, if you're like a few points off, you could have symptoms that could be very detrimental to your health, and people can even end up in the ICU. So it really depends on what lab. When I say it's a few off, it really depends on which lab. Like something like sodium and potassium. Potassium affects the heart, and it's kind of very strict range. Now, chloride. Chloride is normal range is 96 to 100.8. Chloride is an essential element and is a major anion in extracellular fluid. So in the extracellular fluid outside of the cell, the major cation is sodium, and so cation means plus and anion means minus, which is chloride is the major anion for outside the cell. It could be elevated with dehydration, hyperparathyroidism, and it could be decreased, congestive heart failure, Addison, a whole bunch of reasons it could be decreased. So next we go on to potassium. Potassium is one of those labs that have a very narrow range that you want to stay in, 3.3 to 5.1. It's an essential element and is a major cation in the intracellular fluid. It could be elevated in end-stage renal disease. A lot of these labs could be elevated with renal because the kidneys are in charge of the waste and getting rid of stuff, and if they can't, then it builds up in the blood, and a lot of these stuff become elevated in the blood. It could be decreased with vomiting, diarrhea. They just keep belching it out, or it's coming out the other way. And a lot of times you could also have a diuretic that will make them pee, and they'll lose potassium with that. Next, we go on to carbon dioxide. Carbon dioxide normal is 22 to 29. It's a natural gas. When cells convert sugars and fat into energy, then carbon dioxide is a byproduct of that conversion. So this byproduct of carbon dioxide, it travels through the blood and into the lungs where it's exhaled out of the body. So every time you breathe in oxygen and you exhale carbon dioxide. Okay, next we go on to the anion gap. So the anion gap normal is 8 to 16. Anion gap, like the name says gap, is a difference between the measured cation, so the positively charged, and the negatively charged. It's primarily used to determine the causes of metabolic acidosis, so like DKA, etc. So this just explains it a little bit better, the anion gap. It basically says that because the plasma is electroneutral, the anion gap represents the concentration of unmeasured ions. So there are normally more unmeasured ions than anions and cations, which is why there's a gap. So like I said before, it's useful in aiding the acid-base disorders. Okay, next we go on to the CMP. CMP stands for Comprehensive Metabolic Panel. So instead of the basic panel, like the BMP, we have a comprehensive. So it includes what the BMP does, but includes 6 more tests. And so these are the 6 more tests. ALP. ALP stands for alkaline phosphatase. A normal one is 40 to 140. And what it is that it's an enzyme that's present in all different types of tissue, but particularly concentrated in the liver, bile duct, kidney, bones, and placenta. It's mainly used to diagnose hepatobiliary diseases and bone diseases associated with increased osteoblastic activity. So, for example, if it's elevated, bone diseases, that could be Paget's disease, rickets, etc. Next, we go on to total protein. Total protein is 6 to 8. It's a measurement of the total protein, like the name says, in the serum, this includes albumin, globulin, albumin, etc. It's decreased in malnutrition, gut disorder, some reason why they can't absorb it, and it's elevated in autoimmune disorders, bone marrow disorders, etc. Next we go on to albumin. Albumin is 3.5 to 5. It's the most abundant protein in the blood, and it's synthesized in the liver. So if it's low, it could be liver failure, could be a reason. It's mainly used to assess nutritional status. Next we go on to the total bilirubin. It's used to assess liver function because bilirubin is a yellow breakdown product of normal heme catabolism. So total bilirubin measures the direct and indirect forms of bilirubin. So it's used to assess a liver function. If it's elevated, it usually points to a damaged liver, like liver disorder like cirrhosis, etc., or alcoholism. Next we go on to AST and ALT. AST is aspartate aminotransferase, and the ALT is alanine transaminase. So what AST's normal range is 12 to 40. AST is an enzyme associated with liver cell damage. It's found in the liver, the heart, the skeletal muscle, kidney, brain, and red blood cells. So because it's found in all those places, its elevation could indicate a liver disease, but it could also indicate damage of any of those type of stuff. So skeletal muscle, so it could indicate muscle damage. In the heart, so it could indicate an MI. In the brain, etc. So it could indicate a whole wide variety of stuff. ALT, on the other hand, whose normal range is 9 to 47, is an enzyme associated with liver cell damage also, but it's predominantly found in the liver, so it's a more specific indicator of liver inflammation than AST. So like I said before, they're both enzymes associated with liver cell death, but one is located primarily in the liver and one is located in the liver, but also in the heart, kidneys, etc. So that's why ALT is more specific to liver disease. If it's elevated ALT, then it's usually pointing to the liver, like we said before. So Tylenol toxicity, because Tylenol affects the liver. All different liver stuff, liver failure, liver abscess, liver cancer, etc. Just liver damage is ALT, pretty much. And AST, like we said before, corresponds to all those different sites, the heart, the kidneys. Okay, next we go on to other electrolytes not listed before. So phosphorus, normal range is 3.5 to 5. It's a major cation of the intracellular fluid, so in the cell. If it's high, it can indicate a whole bunch of stuff like end-stage renal disease, Addison's, metabolic acidosis. If it's low, it could be because they either pooped it out or spit it up, so vomiting, diarrhea, alcoholism, folic acid deficiency, etc. Next, we go on to magnesium. Magnesium normal range is 1.8 to 3. It's a major intracellular cation. Causes of too high could be from magnesium overload, like they're getting too much IV magnesium, Addison's disease, renal failure. Causes of it being too low is alcoholism. Someone who's a chronic alcoholic usually don't have good electrolytes, usually malnourished. We go on to the lipid panel. So the lipid panel, we first start out with our total cholesterol. Cholesterol is a steroid. It's synthesized in the liver and intestinal wall. If it's too high, usually it indicates a metabolic syndrome, stress, someone who sits, doesn't exercise, eats bad, etc. Too low, there are some causes, but it's usually used to assess a risk factor for cardiovascular disease. So if it's over 200, usually the higher it goes, the more they're at risk for heart disease, clogging of the arteries. The same thing goes with triglycerides. Triglycerides you want under 150. They're the major forms of lipids in the body. Triglycerides, if they're too high, also indicates metabolic syndrome, sedentary lifestyle, and they're also used to assess one's risk factor for cardiovascular disease. Another one to assess a risk factor for cardiovascular disease are HDL. HDL is the good, LDL is the bad. HDL is a lipoprotein that transports cholesterol throughout the body. It's usually good if someone's in shape, eating well, and it's usually bad if they have metabolic syndrome, they don't move, they don't exercise, they eat bad. The higher your HDL, the lower your cardiovascular risks, as opposed to the cholesterol, triglycerides, and LDL, the higher it is, you have more risk for cardiovascular disease. So your LDL is also a lipoprotein that transports cholesterol throughout the body, and the VLDL is a lipoprotein that transports triglycerides throughout the body. If any of them are elevated, they both indicate the same thing: metabolic syndrome, stress, someone doesn't eat right, doesn't exercise, etc. So now we're going to talk about the thyroid hormone. The thyroid hormone we're going to start with is TSH. TSH is a peptide hormone that is synthesized and secreted by anterior pituitary gland. So if there's a problem with the pituitary gland, there's going to be a problem with your TSH. What it does is that it stimulates the thyroid gland to produce the main hormones, which is T3 and T4. The main thyroid hormone, which is T3 and T4, is like the messenger when it's too low or too high. So if the thyroid hormones are too low, the TSH is going to be high because it's going to go ahead and tell the thyroid hormones to produce more. If the thyroid hormones is too much, it's going to go ahead and tell the thyroid hormones to slow down. So it's going to have an inverse relationship with the thyroid hormones, T3 and T4. So when one's up, the other one's down. When the other one's up, the other one's down. And so it's going to be elevated in things that are underactive thyroid, like Hashimoto's, etc. Because if it's underactive and it's too low, then TSH is going to be elevated to tell it to produce more. And it's going to be low causes of TSH is going to be the opposite, something that is hyperthyroidism, too much, because then it's going to tell it to slow down. Total T3. Total T3 is a combination of bound and unbound. And what I mean by this is that T3 is a hormone produced by the thyroid. The thyroid hormone circulates primarily bound to carrier protein, so they're called bound T3, but a small number of them circulate unbound, which is called free T3. Only the ones that are unbound, which is the free T3, are active. And the total T3 is a combination of the bound and the unbound. So T4 is a hormone produced by the thyroid. It's a precursor to T3. So when needed, it is converted to T3. It also comes in two forms like T3, which is the bound, and the free. Next we go on to reverse T3, which is RT3. Normal reference for that is 10 to 24. So what happens over here is that the body converts T4, which is inactive, into T3, which is the active form. It also could convert it into RT3, which is reverse T3, inactive. The problem is that when this reverse T3, when it bonds, nothing happens, but it doesn't, because it's bounded, the regular T3, the free T3 that's active, cannot bind on. So it takes the space of it, but it doesn't do anything. So it competes for receptors at the cellular level with T3. It's kind of a controversial test, so it's really not clear what to do if it's elevated, so many people don't even order it, but this is just a test. The next thyroid one in the panel is going to be your anti-TPO, your thyroid peroxidase antibodies. So you want under 9. What it does is that it detects antibodies against TPO in the body, suggesting a thyroid autoimmune condition. Okay, next we go on to the iron panel. So when we talk about iron, for males and females, it's slightly different. For males, 70 to 175, and for females, 50 to 150. What iron is that it's an essential element that is needed for proper red blood cell function. As we know, red blood cells transport oxygen from the lungs to the rest of the body. Freely dissolved iron is toxic, so instead of iron just being floating around the blood because it's toxic, it's bound to a protein like ferritin, transferrin, hemoglobin, etc. So serum iron measures the amount of iron in the blood. So it's going to be elevated if someone's taking too much iron, like iron supplements, iron infusions. Also in other conditions like hemochromatosis, etc. It's going to be too low if they don't have enough iron, like anemias, blood loss, they're not eating enough iron, they can't absorb the iron. Next we go on to ferritin. Ferritin is different in males and females, the amount. And what it is that it's a protein that stores and releases iron in the body. So basically, if it's storing and releasing iron in the body, it's a measure of how many iron is stored in the body. Too much, it could be that they're taking in too much. Too little, it could be that they're not taking in enough iron, or that they can't absorb it for some reason. The total iron binding capacity, TIBC, is 250 to 450. And what it is that it measures how well iron attaches to transferrin and other protein in the blood. It's an indirect measurement of transferrin. If it's too high, it can indicate anemias, that they're not eating enough iron. Next we talk about transferrin. Transferrin is different also between males and females, 215 to 365 in males, 250 to 380 in females. And what it is, it's actually a protein that helps to transport the iron through the blood to various parts of the body. So if it's high, then it can indicate anemias, the iron's not being absorbed well, or they're not taking in enough iron. Transferrin saturation is basically just a percentage of transferrin that is saturated with iron. So meaning how many places on your transferrin that can hold iron are actually holding it. So if it's elevated, it's an iron overload, and if it's not, it's iron deficiency. Okay, next we go on to coagulation. So coagulation labs. So PT, PTT, and INR. PT stands for prothrombin time. Normal is 12.5 to 14.8 seconds. What it is that it measures the number of seconds it takes your blood sample to clot. If it's too high, it can mean that it's taking longer than normal to clot. And if it's too low, it can mean that it's clotting more quickly than normal. Next, we go on to the INR, International Normalized Ratio. And The lab number is a little bit different for different conditions. So normal is 0.7 to 1.3 around, obviously different per lab, but for those on DVT prophylactics like warfarin, you want it between 2 to 3 is a therapeutic range, and for those with mechanical valve, it's 2.5 to 3.5. What it is that it's a standardized way of expressing the PT value. Ensures that the PT value results obtained from different labs could be compared. If it's too high, it means that you're at risk for bleeding, and if it's too low, it means that you're at risk for blood clots. PTT, partial thromboplastin time. What it is that uses a blood sample to measure how long it takes for your blood to make a clot. So if it's too high, it's taking too long for your blood to clot, and then you're at risk for bleeding out. If it's too low, then it's taking much too quick for your blood to clot, and you're at risk for a clot. So next we go on to the D-dimer. The D-dimer you want below 0.5. What the D-dimer is, it's a protein fragment that the body makes when a clot begins to break down and dissolve in the body. The D-dimer is very helpful to diagnose DVT, PEDIC. Not diagnose it solely, but to help rule it out, to help aid in a diagnosis. But there are 7 conditions that could cause a D-dimer to be elevated in the absence of a clot, in the absence of a PEDVT, like pregnancy, malignancy, infection. So therefore, you really should only use the D-dimer in the setting of a low suspicion for PEDVT to rule it out. Next, we go on to fibrinogen, that is 200 to 400. And what fibrinogen is that's a protein precursor of fibrin. Fibrin and platelets are the main constituents of blood clots. So basically what it does is that it helps the blood to clot. It's used in the workup of coagulopathies. If it's high, it can indicate a clot, whether that's an MI, malignancy, etc. If it's low, it can indicate bleeding out, DIC, liver disease. Okay, next we go on to inflammatory markers. Inflammatory markers, we're going to start with our CRP. CRP stands for C-reactive protein. Normal range is less than 0.5. And what it is that's an acute phase protein that is made by the liver and released into the bloodstream with inflammation. So it's really non-specific, so which is why you need clinical correlation. But if it's high, it indicates inflammation. ESR is the next one, erythrocyte sedimentation rate, also known as a SED rate. You want it under 20. What it does is that it measures the distance of red blood cells have settled in a vertical column of anticoagulated blood in an hour. So basically, it correlates with inflammation of various disease states like collagen vascular disease, endocarditis, malignancy, etc. But it's a very non-specific measure of inflammation. So it tells you there's inflammation going on in the body, but you can't pinpoint where or what. Next, we go on to uric acid. So uric acid, the normal is 3 to 7. What uric acid is that it's the end product of purine metabolism, protein waste product. So usually people use it to diagnose gout. So if it's high, it could indicate gout. It could also be caused by other dietary stuff, and a low uric acid could be caused by medications, SIADH, etc. It's primarily used in a gout differential. Okay, now we go on to cardiac markers. So we're going to start with proBNP. ProBNP, you want it to be under 300. ProBNP is a precursor protein that is continuously produced by the heart. After release, it splits into its active hormone, which is BNP, which we're going to talk about in a minute, and inactive fragments, which is proBNP, into the blood. So it basically is used for congestive heart failure. So if someone, it goes by age as we see before, but if someone is under 50 years old and has over 400, it's a high risk factor for congestive heart failure. BNP is a hormone released from the heart when the ventricles are distended. So that could indicate heart failure also. When the heart pump fails, then you're going to have your ventricles are going to overwork, and then it's going to be distended. Just like any other muscle, when you continuously work it, it's going to be distended and built up. Troponin. So troponin is a protein that is found in muscles, and they help regulate muscle contraction. There are 3 different types of troponin. You have your skeletal muscle troponin, and 2 cardiac muscles. So over here, we're just going to be talking about the cardiac muscles one. The cardiac muscle troponin include your cardiac troponin T and cardiac troponin I. They're normally found in the muscle and should not be found in the blood. When the heart's damaged, they're released into the bloodstream, and that's when they're elevated. So if they're elevated, it usually indicates a cardiac cause like MI, myocardial infarction, myocarditis, acute heart failure. First of all, you should note that you should not use troponin by itself to rule out or make a diagnosis of a heart attack. You need ischemia, etc. When it comes to troponin, it could also be elevated with other stuff like chronic kidney disease, hypertension, some other chronic diseases. So you really want to look to see if it's trending upwards or if it's unchanged. Like this is the normal. The normal is to be elevated, like someone with chronic kidney disease. One more thing when it comes to troponin is that you have the delta troponin. The delta troponin is basically the change or the difference from the first to the second. So like I said, they have to be trending upwards, and the delta troponin is very important for that. The next thing we're going to talk about is the creatine kinase. Creatine kinase, which is CK, and creatine kinase MB, which is CKMB. So the difference between the two is that creatine kinase is basically an enzyme that is found in the skeletal muscle, the heart muscle, and small amounts in the brain. So if any of those following tissues are damaged, they're going to leak creatine kinase into the bloodstream. There are 3 different types of creatine kinase enzymes. Some of them are found mostly in the skeletal muscle, but CKMB is found mostly in the heart. So that's why it's more specific for the heart. So creatine kinase is basically just going to be elevated if any of those stuff are elevated: skeletal muscle, heart muscle, or in the brain. If there's any of those are damaged, those will be elevated. But CKMB is more specific for heart. Okay, now we go on to the hormones. So the first hormone that we're going to be talking about is testosterone. So obviously it's going to be different for males. You want a higher value, and for females you're going to have a much lower value. So for males, the normal reference is between 193 to 825, and for females 15 to 70. So obviously this is not set in stone. Each lab reference is different. What testosterone is that it's a hormone that the gonads, which is either the testicles or the ovaries, produce. It's naturally found higher in males versus females, like I said, and it's the main androgen, meaning that it stimulates the development of male characteristics. So it's going to be too high in PCOS, congenital adrenal hyperplasia, ovarian or testicular tumors, adrenal tumors, and steroid use. It's going to be low in different genetic disorders like Almond syndrome. It's going to be low in adrenal or pituitary gland disorders, injury to testicles, etc. It's usually used in a workup of fertility. So next we go on to progesterone. So the range, in terms of the value, it really ranges on where you are in your menstrual cycle. And what progesterone is that it's a sex hormone made in the adrenal cortex and by the corpus luteum. It prepares the endometrial for a fertilized egg to implant and grow. So if pregnancy does not occur, the lining is going to be shed, which means that they have their period. And if pregnancy does occur, then the progesterone is going to increase to support the pregnancy. It's elevated in molar pregnancies, ovarian cancer, adrenal disorders, and it's too low in anovulation, so there's no ovulating, PCOS, someone who's under a lot of stress, hyperprolactinemia. In terms of FSH, which is follicle stimulating hormone, it's a hormone, like the name says, that it's produced in the pituitary gland, and it helps to regulate the menstrual cycle. It also stimulates the eggs in the ovaries, and in men, it helps to control the production of sperm. So if it's too high, some causes could be ovarian failure, tumor, menopause, PCOS, thyroid disorders. And if it's too low, like we said, it's produced by the pituitary gland, so there could be disorders of the pituitary gland, hypothalamus, etc. It's usually used to assess or test for menstrual problems, menopause, or infertility. The next hormone that we're going to be talking about is LH, which is luteinizing hormone. LH, the ranges are going to depend on where you are in your cycle, and for males, it's pretty consistent between 2 to 12. And in pregnancy, there's pretty much not really much, it's under 1.5. So what it is that it's a hormone produced by the pituitary gland that's going to stimulate ovarian ovulation and maintains the corpus luteum in pregnancy. So it's responsible for secreting progesterone, and in males, it's responsible for secreting testosterone. Some causes why it could be elevated are menopause, PCOS, primary testicular injury failure, some genetic stuff like Turner syndrome, and some reasons it could be really low are anorexia, malnutrition, Kalman syndrome, pituitary failure. Another hormone is prolactin. Prolactin is a hormone that is released by the anterior pituitary gland, and it stimulates milk production after childbirth. Some causes of it being elevated is renal failure, prolactinoma, hypothyroidism, certain medications, and some reasons why it could be really low is hypopituitary and Sheehan syndrome. The last hormone that we're going to be talking about is estradiol, which is E2. So estrogens are basically a group of hormones that play a key role in the female reproductive health. There are many different types of estrogens, but the three most common ones are testosterone, which is the one that is made after menopause, estradiol, which is what we're talking about here, which is the main one in non-pregnant females, and estriol, which is the one that increases during pregnancy. So some reason it's going to be elevated is estrogen producing tumor, gonadal tumors, induction of ovulation, so someone who's getting fertility treatment. Some reasons why it could be too low is hypogonadism and delayed puberty. So here are some other labs that don't fall under like a CBC, CMP, but just good labs to know and order when needed. So hemoglobin A1C. Hemoglobin A1C is basically a measurement of the average blood glucose over the prior 3 months. More specifically, the A1C test measures what percentage of hemoglobin proteins in the blood are coated with sugar. So basically, the reason why this is used to diagnose diabetes is because you could eat a cookie or eat a donut with icing right before you're going to take the test, and then your glucose is going to be elevated. So you can't say the person has diabetes just because they just had a cookie or orange juice right before. So the hemoglobin A1C about their blood sugars for the past 3 months. So it gives pretty much an average blood sugar over a 3-month span. If it's under 5.7%, that means that they don't have diabetes. 5.7 to 6.4% indicates prediabetic, and over 6.5 indicates diabetes. So that's pretty much what it's used for. Amylase and lipase. Amylase, the normal range is 22 to 140, and lipase you want under 70. So they're both enzymes that help to digest, but amylase helps to digest carbohydrates, and lipase helps to digest fatty acids. So because they're made by the pancreas, if they're elevated, then it's usually a sign of acute pancreatitis or pancreatic cancer. And if it's too low, it's usually a sign of chronic pancreatitis or cystic fibrosis. So they're pretty much used to assess or diagnose like pancreatic disease or pancreatitis. Okay, so the last slide we're going to be talking about. So first of all, lactic acid. So lactic acid, you want the level to be below 2. So it's an intermediate breakdown product of glucose metabolism that's produced primarily from anaerobic metabolism in the muscle. So when talking about anaerobic metabolism, you're saying without oxygen. So if it's elevated, you're going to worry about oxygen deprivation in the tissues. So normally it could increase a little bit with strenuous activity because there's a little bit less oxygen getting to the tissues, but it should be removed by the liver. If it's excessively accumulated, it could be due to liver failure or liver disease, or it could be due to oxygen deprivation that keeps going on. Not that you exercise and then you stop and then everything's normal. So causes of high, like I just said, would be some causes of inadequate oxygen delivery, which is either from shock, blood loss, not enough oxygen getting around, or a disproportionate oxygen demands like trauma, carbon monoxide exposure, ischemia, or not enough oxygen utilization like in a seizure. The next one is procalcitonin, which levels are usually below 0.5. Procalcitonin is a prohormone of calcitonin that's produced after an inflammatory response. It's usually increased also after a significant bacterial infection. So that's why it's useful in differentiating between bacterial or non-bacterial infectious disease processes. And like I said before, it's produced after an inflammatory response, so that's why it could be elevated with inflammation like allergies, autoimmune disease, etc. And last but not least is vitamin D. Vitamin D normal range is 30 to 74. Vitamin D is a fat-soluble vitamin that is important in calcium absorption and bone metabolism. So if someone has too high, it's usually because they're taking too much supplement. And if someone has too low, it's usually, a lot of people are low because most people don't have enough sun exposure. It also could be caused by malabsorption. And that's pretty much it. Pretty much this whole thing is your basic labs that you're going to see. Obviously, there's a bunch, millions of other labs. There's cancer labs. There's all different specific labs. And like I said before, never use it to diagnose patients. Always use it in conjunction with other stuff. And you always want to assess your patient, know their baseline, and contact a doctor. So pretty much these are just telling you what the lab is, what causes it to be high, what causes it to be low. This is not all-inclusive. And just because something's on the list doesn't mean you have it or someone else has that. You always want to use your clinical judgment and the whole picture. So if you have any questions, just ask in the comment section below, and I hope you enjoy.